How's it going? My name is Shyam. I'm the current senior advisor for the ASA Medical Student Governing Council, and we have a new addition to our program director interview series. We have the honor of speaking with Dr. Ladlie from Mayo Clinic, Jacksonville, and it is such an honor to have her here. It's the first video that we're doing for the program, so it is. We're very appreciative of your time. Thank you so much for being here today, Dr. Ladlie.
Thank you for having me. Nice to meet you.
Nice to meet you too. So just to get started, could you please tell us a little bit about yourself and how long you've been a program director at Mayo Clinic, Jacksonville?
So I am about to start on my 46th journey around the sun. And I did my own training at Mayo Clinic, Florida, where I finished my regional anesthesia fellowship in 2009, but even my core residency before that. And I joined staff immediately after that. So I've been on staff for almost 15 years now. I am a mom of two. I have been the program director since 2016. And I'll tell you that ever since I had a good understanding of what a program director was, I knew that that was going to be part of my career path.
Amazing. That is a lot of good accomplishments. Even the mom part, that is so supreme to anyone's life. So that's really awesome that you've been handling that and being a program director. Congrats to you, and hopefully for a very long future ahead. What would you say you love most about your program?
So I think my program is the most special because, when I coach medical students, one of the things I tell them is, do you see yourself in a big program or a small program? And I think there are advantages and disadvantages to both. Obviously, I'm partial towards the small program. We're a class of 4. We're growing to a class of 6, but that's still very small considering the size of our department. So I will say that we have some of the resources and advantages of the huge Mayo healthcare delivery system, but repackaged into a small program so that we can have some of the advantages of both, but lack some of the disadvantages of a big program.
Mm-hmm. Nice. What would you say on top of that makes your program unique?
So that specific thing, I feel like we can deliver a very customized, tailored approach to each resident. So we have almost 40 anesthesiologists, and we have experts and fellowship trained experts and really well-known research academia experts in pretty much all fields of anesthesia. And we have access to those people, the 40 docs, the 100 CRNAs, but yet still right now only 13 residents. And even when we grow to our biggest size of 18 residents, so you really get individualized access points to the resources, even to the rotations. If your own career goals change or your life changes, we can pivot to accommodate that without a problem. And then, additionally, we get there's not as much competition as there can be in some programs for the biggest and best cases. So for example, on any given Tuesday, we might only have one resident in a cardiac rotation. And so they get the most challenging cardiac case for their level of expertise on any given day.
That's awesome. Yeah, like the world-class resources of Mayo Clinic with a very nice intimate class size would definitely be very, very helpful for any resident. I can be sure of that. You had mentioned that you're growing your class size to 18. Is that when is that change happening?
So we recruited for a class of, we matched 6 interns. So a total cohort of 18. So a class of 6. Gotcha. Yep. And so our 6 interns will start with us this July. So from 4 to 6 per class.
Awesome. That's very exciting. How do you weigh the different components of a residency application to determine who to give interviews to?
So I was trying to decide when you gave me this question in advance, how much to reveal goes on behind the curtain. But the truth is, I think it benefits us all to really know what the programs want. And I honestly feel like we all want the same thing. We want people who have done a lot of self-reflection to feel the best you can from the perspective of a medical student that anesthesia is the right career for you. Mm-hmm. And then you've done your due diligence to looking at the different programs and the strengths and weaknesses and identifying which of them meets your own career needs the most. So when I look at ARIS, and when our whole recruitment team looks at ARIS, and we refresh with this training every year so that we all are in alignment with what we want in a resident. The most important thing we look for in ARIS actually is probably geography. So we attract largely from the Southeast quartile of the United States. So we will review those applicants very first. when we review the applicants, the first thing we look at, or the thing that we weight the most, is certainly the personal statement. So I always tell people that when I meet you, I should be having our second conversation, because the first conversation we had was one-sided when I read your personal statement. And then I'll tell you that for me and for us, for the recruitment committee here, things like letters of recommendation and the MSPE and even transcripts from your medical school are primarily used to identify red flags. So we care very little if you didn't get all A's, but it might matter to me if you had to repeat a class, especially if your evaluators felt like that was lack of effort. So and the same thing, like with letters of recommendation, all letters of recommendation paint the perfect picture. And in most cases, that picture is accurate as well. So if I find a letter of recommendation that tells me that this person was habitually late, or they paid really close attention to make sure their schedule was as fair as the other people's, those are red flags to me. And those are the things that we use letters, grades, and transcripts for.
I see. Oh, those are very unique answers. I haven't heard that before. So thank you so much for a really unique perspective. As you know, like step 2, the massive change that happened with the board exams, and step 1 going pass fail. Do you have any insight as to how you would weigh that, the scored step 2 in your new applications?
We had already transitioned to using, as soon as they announced the transition to pass fail, and program directors were not widely supportive of that. It is hard for us to compare someone from one school to the next. The standardized test score was a level playing field in some ways, but as with all standardized tests, we still know that there's inherent bias built into that. And there are some schools that teach to the test or give time off to study for the test. So there are disadvantages and advantages between medical schools. So even that wasn't particularly fair. So even when they announced that change, we switched to using USMLE as pass fail as well. I do think step 2 will have an increased weight at many programs. We probably aren't one of them. So that's going back to our earlier reflection on the advantages of a small size. Like, I need 6 people who want to spend 3 years with us. They want to work hard and play hard. And that's what we're looking at. And that is not hard to find in ARIS.
Awesome.
So we actually don't need the scores as much as some schools to be able to find that.
Amazing. Thank you so much for those very genuine answers. It means a lot. As you know, many interviews are just 10 to 20 minutes long. How do you weigh these brief interactions in composing your rank order list?
So the interviews are tricky. And there are some things I even told you before this interview started, that there are some things that I really appreciate that COVID brought. And actually the virtual interviewing is one of those. It's more efficient for people. It removes some of the barriers of travel and cost and time off of school. So I'm all about that. The only problem is that now we will sometimes match people. We have a current intern who the first time they ever saw Jacksonville or saw Mayo Clinic, Florida, was the first day of their intern year. And I feel like it's not easy to get a sense of us either. It's not easy to get a sense of our culture, about what we're about how the residents fit together and what kind of a work family we make, unless you visit us on campus. Trying to showcase that on Zoom or whatever virtual interview platform you're using is tough. So there are a few things that I feel like make sense. The first thing is, still like any interview, to definitely be on time, to make sure you're at a place where you can troubleshoot IT issues. That is a dreaded fear on our side, but I know on the candidate side as well. So get to a place where you have super reliable internet, where there's not a lot of background noise if possible. I'm using a virtual background to cover up for the fact that I'm at my own house right now. So, but if your virtual background is distracting, that can be a problem as well. And then the sort of the same things that you adhere, some of the same principles as for in-person interviews, as I feel like being formal. So the interview environment is a formal environment. So one thing that I feel like Zoom and our constant interaction with Zoom has done is made people feel more casual, like we're friends and maybe not a prospective sort of residency director. So I'd caution against being too casual. And the other thing I would say is I'll tell you, you'll get the question all the time, strengths and weaknesses. My personal pet peeve, but I think it's a widely shared pet peeve amongst program directors, is to give us fake strengths as weaknesses. So, I can't say no, I work too much, things like that. So don't be afraid to be vulnerable. I'm looking for people I can relate to, for people I want to be. I mean, if I do a really good job, we'll recruit you for staff, and I'm going to work with you for the rest of my own career. So don't be afraid to be honest, vulnerable, sincere. You don't have to people have weaknesses. You don't not being able to share a weakness on an interview doesn't mean you don't have them. It just means you're too embarrassed to share.
I see. So it seems like the interview is like a large component of how you rank your candidates after like you review their applications. It's a really important part. Okay, that's good to know.
Yeah, and I would say also, we stress even on our interview days that by the time you are offered an interview with us, you're well qualified. And in many ways, program directors have such a luxury, right? You've already been vetted by so many systemic things, the medical school admissions committee, all the people who evaluated you during medical school. If you've gotten to the point to apply during ARIS to anesthesia, you're well vetted already. So then further, by the time we offer you an interview, you're more than qualified. So now it is a mutual trying on of where does the candidate want to spend their next 4 years working and training, and who do I want to spend the next 4 years with training as well. So I definitely think it's a bi-directional format.
Gotcha. You had mentioned students have a lot better of an experience getting to know your family experience and all that by visiting your actual campus. Do you give any advantage or preference to students who do away rotations at your program?
So unfortunately, I think that away rotations and externships, or however you want to say it, have elevated importance now in the virtual recruitment environment. And not even just away rotations, but away relationships. So if you feel like you're really interested in specific programs, forge some relationships if you can with people at that school already. And I will say, I feel like mentorship and sponsorship is more important now than ever. So there are so many medical schools where anesthesia isn't part of the core experiences, and the medical students have to seek out their own experience in anesthesia. There are now nationwide programs where you can have mentors in anesthesia, even if anesthesia isn't part of the faculty at your own school. So those kind of things I don't feel are necessarily fair, but I think it's a reality until we develop a better playing field.
I would agree. Yeah, definitely agree with that. What would you say makes a successful resident in your program overall?
So almost all residents are successful at our program, and I bet all program directors share that sentiment. And part of it is what I've already told you about, like, people are well vetted. They're wildly successful people by the time you even get to us. But I will say what separates people who are basically outrageously successful from those who are sort of normally successful is how invested you are in your own career. And even I will go as far as to say that people who really have a lot of emotional intelligence and do a lot of self-reflection on work-life integration and what their priorities are, even during training and beyond, so therefore also are able to really clear and protect a space for independent study and identifying their own weaknesses are wildly successful. So I feel like probably all training programs, you get out of it what you bring to it. Probably everybody has a solid depth of resources for you to learn our field, at least as well as anyone can learn it in 3 to 4 years. And then beyond that, really finding your niche and finding the areas that interest you the most, where you become that lifelong learner. People who come to residency with that skill set are at an advantage at the beginning, but people who develop that skill set while they're here, and we see that a lot as program directors, soar.
Gotcha. That's very good to know. Yeah, it seems like you guys really do tailor your program to make sure they're coming out of the program like that too. So that's really nice to hear. Very lastly, what advice do you have for those interested in anesthesiology who might not be applying the cycle, or who might be applying this upcoming cycle?
This is a tough one because I suspect that the candidates are pretty savvy and they look at the AAMC data and the ARIS and the NRMP data last year, which was pretty eye-opening for anesthesia, right? The applications soared. The match rate did not go up. There weren't a ton of increased positions. So the overall take home is that it's harder to match in anesthesia. And now you pile on this idea of virtual recruitment and having to be able to really demonstrate your personality in a 10-minute virtual interview, that is so tough. Really, really tough. So I want to extend my sympathies to people who are experiencing, in some cases, one of the first professional interviews of your life in this format. That being said, you already know that I feel like there are at least as many weaknesses for standardized tests as there are strengths. But those are differently perceived for program directors across the nation. So it definitely can only help you to do well on standardized exams. And so I think that now that USMLE 1 is pass fail, there will be an increased emphasis on the score for step 2. So I definitely encourage people to do whatever works for them to maximize the score on step 2. Those externships and away rotations, we already talked about a little bit, but the bottom line being to really be able to showcase who you are and your dedication to your own learning and career development, however that matters. And you can reach out for feelers and relationships in ways that are less than away rotations, especially if your own school doesn't have a training program. I will say, I think I've heard mixed reviews on what the signaling has done for other subspecialties, but as you know, this year we have signaling for anesthesia. And I know for us, for sure, that we will look at signaling the way we do for that Southeast quartile of the United States, that people who signal us will get sort of a priority review. And, so last year, I think we got 1,300 applications for our 6 positions, and we do our very best to review those holistically. But so what we do is holistically review them by tier. So one of the top tiers will be the signaled people, the Southeast quartile people, and then a few other ways that we kind of separate out the ARIS. But strategically think about the signaling, and then leverage mentorship and advisorship. One of the things that has gotten more popular in the last couple of years is emailing program directors by your own advisor. And I don't love that system because I don't feel like it doesn't add to the body of knowledge that I have about the candidates. And I already spent a lot of time carefully reviewing what they've compiled in ARIS. So additional emails from faculty at other medical students that tell me that this is a great candidate is sort of just like an additional letter of recommendation, in my opinion. So I don't want to encourage that practice. So really I would limit it to those other things that I've said, the signaling and the step 2 and the externships when available.
Yeah, that's amazing insight. Like, yeah, I totally forgot about the signaling, but that's huge. And especially for a program that does, prefer applicants who are like looking into that particular region, that is really, really helpful to know. So
I will say too, that, you have the option of making your personal statement, you can tailor it for programs. And I think that that's another way to signal programs, like maybe a tier 2 kind of a signaling. So, and I think all of us understand that your personal statement can be exactly the same, except for the last paragraph. And if you tell me something like, this is why Mayo Clinic speaks to me, then that would make sense to me when I read, and I would understand perfectly that you're going to say that as well to maybe like another program that's similar to us, because you've researched them as well, and they might be a good fit as well. But adding a personal note or two about why our program makes it easier for me to understand you from the other 1,299 applications I read.
Right. Yeah. And like you were saying, that one-way conversation, you'll like keep that in mind. And then in the interview time, you'll know that they had that preference. So yeah, that's really key. That's awesome to know. That is so helpful. I am sure that any applicant or student who watches this is going to find that really, really nice and good to know for their future career. So
I want to cheat and give you one more food for thought that wasn't part of your questions. But one of the things that I feel like, I guess it is a question. I want to go back to that. What makes us unique?
Mm-hmm.
We're small enough that we can really get the feedback from our residents real time. And we definitely have the philosophy that solutions to resident problems probably also come from residents. Mm-hmm. So I think that any resident in our program would agree that we're open to feedback and critical feedback, and we're especially open to solutions, even if they're major pivots in the program that make things better for everyone.
Yeah. It seems like with the small classes that it's kind of hard to get lost in the weeds of like many different faculty and, classmates and all that. So yeah, it does seem like, Mayo Clinic shows really, really keen attention to every single person that joins their program. That's a
strength. That's one of our strengths and our weaknesses, right? You can't hide. Yeah.
I don't think so. That's so reassuring to know. And yeah, any future applicant who looks at this is going to think that's a really nice thing to know about the program. But yeah, that is all the questions I have for you. Thank you so much, Dr. Ladlie. Again, this is really an amazing interview, and I'm sure it's going to be very helpful for all future generations of anesthesiologists looking at this. So
Thank you. And like I told you before, thank you for doing this project. Like, we struggle with how we can teach people who we are. And I really feel like this specific video project targets that need. And it was a huge gap. So thanks.
oh, of course, that's very heartwarming to hear. It's an honor to do it. So thank you so much again. Wish you all the best. And thank you again for all your time.
Thank you. Nice